Hello, and welcome to Beating Heart Disease. My name's Kevin Wells, and I'm a heart disease survivor. I had a quadruple bypass about a year and a half ago. Today we're going to be talking about Enhanced External Counterpulsation, or EECP therapy. We're going to talk a little bit about what it is and how it can help you. But first, I just want to say I am not a medical professional. I am not a scientist. I'm not a researcher. I'm in no way affiliated with the medical field, so anything that I suggest here, I suggest you talk it over with your doctor and see if it's something that you should add to your routine. So what is EECP therapy? It's basically where they put what look like blood pressure cuffs to your calves, to your thighs, and to your buttocks. And you're also hooked up to a heart rate monitor, so it's monitoring your heartbeats. And when your heart rests, after a beat it rests, and then it beats, then it rests. When your heart is at rest, these cuffs inflate, which pushes the blood back into your heart, up to your heart. And what this basically does, it makes the volume that your heart expels when it pumps much greater. So what this does for your heart is it creates new collaterals. And collaterals are arteries that are created to help your heart get more oxygen. So like if you have blockages and stuff, and then you have collaterals, if you have collaterals, they can keep you from having a heart attack because your heart is still getting the oxygen that it needs, the blood flow that it needs. Even though you have blocked main arteries, these smaller arteries are still getting the blood flow to your heart, preventing heart attacks and stuff like that. Also, people who have angina, which is, I have angina myself, I suffer from it. I've been able to correct mine with supplements, but a lot of people do this therapy in order to get rid of angina. Also, there's studies that have been shown that it'll help people with atherosclerosis. Sorry, having trouble saying that. You'd think I'd know since I have the disease, but people that have like small vessel disease and that kind of stuff in their heart, where these small little vessels become constricted or blocked, and then they get pain, it's shown to really help those people too. Now, as you can see in this chart, this is several different studies that were done over multiple years. You can see these studies go back quite a while because EECP therapy has actually been around for 50 years. It's just most people don't know about it. But as you can see, some of these, like on the top here, we had the Lawson study, 1998. It shows the angina was decreased. Cardiac perfusion, which that's the actual volume that your heart pumps when when it pumps, was actually increased by 75%. Another study a year later shows very similar results to that one, same location but different year. If you go down a little bit, we've got some other studies that show clear down here at the bottom. 2002, there's a Stents study that showed an 83% increase in cardiac perfusion. Also, several of these show 74% reduction in angina, 88% reduction, 81, 85. And basically, when you don't have angina, that means your heart is getting the oxygen that it needs. If you have angina, that means that your heart is depleted of oxygen. So more oxygen means you have more vessels grown in your heart, which means your heart is healthier and you're less likely to have heart attacks, which means you're less likely to need stents, which means you're less likely to need bypasses. So EECP therapy is a really good thing, and it needs to be promoted more, by doctors. This other study here is actually a graph. It shows a 3-year follow-up from EECP therapy. So as you can see, here's the EECP. Before they had EECP, almost no one had no angina. Almost everyone in the study had angina. You can see class 1, class 2, class 3, and class 4 anginas. You can see the class 3 was the worst, the ones that had the most. Most of the people had class 3 angina in this study. And then as you can see, a 3-year follow-up, most people in the study had no angina. No angina at that point. The class 1s had were greatly improved. Class 2, still hardly had any angina. Class 3, you can see the results are pretty remarkable for just something that's all it is pushing blood back into your heart using non-invasive procedures. So why don't we know anything about EECP therapy? Why does the average citizen or average heart patient not know about EECP therapy? Well, it's because it's not very expensive. It's not really very profitable for the hospitals, for the doctors. An EECP therapy session, although it's pretty intense for the patient because they have to go 5 times a week for 7 weeks, it's pretty inexpensive. It's usually around $5,000 and a little more, $5,000 and up, but way less than a heart bypass surgery. Like if you're talking $5,000 to $7,000 for an EECP therapy treatment for the complete treatment, compared to $150,000 for a heart bypass, it's pretty easy to juggle those two numbers and come up with okay, which one's better for the patient? Monetary wise for us, which one's better for the patient? Well, bypass, stents, those kind of things. EECP's way down here. They don't want, you can't even see my hand because it's so low. Because EECP therapy just isn't that profitable. The other problem is along the same lines is, if you have a machine and you have the machine running 8 hours a day, and you can only do, each session takes an hour, so you only do 8 patients a day, say at $200 a session, that's only $1,600 a day compared to my hospital bill for just the hospital room for them the surgery room for them to do the procedure on me for my open heart surgery was $40,000 for about 6 hours. So 8 hours, $1,600 with EECP therapy, or $40,000 for 6 hours and for just the room for a surgery. So you can see why this therapy isn't promoted more, because there's just no profit in it. The other thing is doctors, have a lot of follow-ups with the bypasses. People have had bypasses, it's very common for them to have follow-up visits to the emergency room, to the hospital, to their doctors. Some people do really well with them, and they don't ever have any problems. Me, I've been back 7 times to the hospital with complications. So, that's another $50,000 tacked on top of the $150,000 for the surgery. So I could have had EECP therapy. If I'd caught it soon enough, I may not have been a candidate for it. I don't know. But if I was able to do it, it's supposed to last up to 4 to 5 years before you have to go in and have it done again. So it's a long-term treatment. You have it done. You're good for 4 or 5 years. Doctors aren't getting any money off you. They might see you once a year for an annual checkup. But that's not nearly as profitable as seeing you every 2 months when you have an angina attack, or every 2 months because you just don't feel well, or you're having breathing problems, or whatever. There's a myriad of things that you can have symptoms of after having a bypass. Believe me, I've had a lot of them. So EECP therapy just needs to come more to the forefront. The only way you can get EECP therapy approved approved by your doctor is if it's like a last resort thing. Like you've tried all the medications, you've tried bypasses, you've tried stents, then they'll say, well, okay, as a last resort, we'll let you try this EECP therapy. In my mind, if they have caught your disease early enough, you should be doing EECP therapy first line. It should be a first line treatment. And then if it doesn't work, okay, then we'll look at stents, and then we'll look at bypasses. But instead, it's the back end. The back end procedure was like, well, if everything else has failed, and we've made all of our money off this guy, and it still hasn't worked, well, let's go ahead and recommend the EECP therapy. Because EECP therapy is approved by Medicare. It is approved by insurance. Most insurance companies will pay for it if your doctor orders it. So, it's not like it's some quack procedure. It's been around for 50 years. Pretty sure it's been approved by Medicare for the last 20 years. and most insurances have approved it since that long too. And the studies, as you can see in the charts, go back into the 90s, early 90s. So it has been around for a long time, and it's a therapy that everybody needs to know about. If you're a heart patient, you need to know about it, because you need to tell your children about it, because if they start having chest pains and that kind of stuff, they need to look into having this done. And the other thing is, we need to, as heart patients, we need to insist that these clinics open up so we can get this kind of therapy, because I don't even have one anywhere near me, and I'm in a city. I'm in Tulsa, Oklahoma, a pretty good sized city, and there's no EECP therapy within 100 miles of here. So if I had to drive 5 times a week for 7 weeks, 100 plus miles, well, most people aren't going to do that. So we need more of these clinics. Now, there is a company that just got FDA approval, and they're kind of marketing it more as an athletic device, because a lot of top athletes are using EECP therapy to improve their VO2 max. So they actually improve their performance in whatever sporting event they are doing by doing this therapy. So if we can get it to kind of come more to the main, to the front line like that, maybe we won't even need doctor's approval to go get it done. We can just go to a gym or a whole body health clinic or something and have it done. We don't have to wait for doctors to say, well, okay, you've tried everything else, let's try this now. No, it should be pretty much almost everybody should be doing it if they passed like a certain age. They should just be doing it just to build the collaterals in their heart, just so they don't have heart attacks. I mean, this therapy could help eliminate heart disease, because if your heart can build new arteries and stuff, and then when you do get a blockage in there, you've already got it rerouted. So heart attacks, may stop. You not even see heart attacks anymore. You may still have heart disease, but we may prevent heart attacks and that kind of stuff by having, rerouted arteries in our hearts. So this is a major therapy, and I'm kind of mad that it's not more mainstream than it is. If you talk to your cardiologist about it, most people I know who've talked to their cardiologist about it don't even know this treatment exists. So it's really sad. But anyway, if you found this video helpful or interesting, please give me a thumbs up. And please subscribe if you would, because that allows you to see when I make new videos. Anytime I find out about some type of new procedure like this, or new treatment, new diet, I'm going to post a video to try and keep the community updated, because we're the ones who are going to cure this disease. It's not going to be doctors, it's not going to be researchers. It's going to be people like you and me that try natural things, that try, EECP therapy and things like that, that actually we're going to be the ones that solve this problem for our children and for humanity. I want to see heart disease eliminated from the human history books. Our generation should be the last generation that experienced heart disease. Straight up. That's just the way it should be, and we need to make that happen. But anyway, well, I hope you like this video, and I'll see you next time.